When the COVID pandemic hit, 75 Toronto shelters reduced their capacity. They relocated almost 3,000 people to hotels and other temporary housing locations. To make it safe for the remaining 7,000 people, they removed bunk beds and replaced them with single beds. It had to be done to maintain physical distancing between shelter beds to stop the COVID-19 transmission.
A coalition of 6 groups who advocate for homeless rights discovered that not all the shelters were meeting the public health standards. They filed a pair of lawsuits earlier this year against the City of Toronto. The Ontario Superior Court ruled that the city breached the interim agreement it had signed with the coalition that requires the Toronto shelters to comply with safety measures.
So the city had not, as we argued, had not reached compliance when it said it had. So on June 15th, it told us that every site was in compliance. And when we investigated that further and got their documentation, it was clear that they were aware of a number of sites that had not yet reached compliance.
Nearly 700 cases of COVID-19 have been reported in Toronto shelters since the beginning of the pandemic. With all the positive cases, some homeless people say they are choosing to live in encampment sites rather than in shelters as they are afraid to contract the virus.
We do more social distancing out here than they do in the shelters. And I don't want to go back to the shelters because of COVID.
There are 75 homeless shelters in Toronto. The city oversees 11 directly and funds the remaining 64, which are run by non-profit agencies, including the Salvation Army Gateway Shelter.
Yeah, the City of Toronto, so Shelter Support and Housing Administration specifically, has been really helpful to us. I don't think it would have been possible for us to decrease the number of shelter residents as drastically as we have without their support. We have been able to open up 2 hotel programs as the Salvation Army with the help of the City of Toronto, and so that's where a number of our previous residents have gone to create more space here.
Now, the City of Toronto has to get a professional expertise from the public health to determine the necessary distancing between shelter beds. They also have to frequently report to the coalition about their actions. I'm Margarita, Maltceva, Observer TV News, Toronto.